Examination of lymph nodes. The axillary group of nodes include the pectoral, that is, anterior, central, that is, medial, subscapular, that is, posterior, humeral, that is, lateral, and apical groups of lymph nodes. All the other lymph nodes drain into the apical group. Position for examination of axillary lymph nodes. The patient is asked to sit straight. To palpate the right axilla, hold the patient's right forearm in your right hand and instruct them to relax it completely, allowing you to support the weight. This allows the axillary muscles to relax. Palpation should then be performed with the left hand. The reverse is applied when examining the left axilla. The lymph nodes are examined by inserting the fingers in the axilla, with the patient's arm relaxed and slightly abducted. The apical axillary nodes receive lymph from all the other axillary lymph nodes, cephalic vein nodes, and upper peripheral breast. To palpate them, the palm is turned medially, and the apex of the axilla is palpated against the wall of the thorax. The apical group is enlarged in breast malignancies. The central axillary nodes receive lymph from the lateral, anterior, and posterior lymph node groups. To palpate the central or medial groups, support the arm as described earlier, relax the axilla, then turn your palm medially, and with your fingertips at the apex of the axilla, palpate against the wall of the thorax, using the palps of your fingers. The anterior, or pectoral axillary nodes, receive lymph from skin and muscles of the supraumbilical anterolateral body wall and the breast. Palpation. To examine the right anterior axillary nodes, support the right forearm of the patient to relax the axilla and slightly abduct the arm. With your left palm facing towards you, palpate behind the lateral edge of the pectoralis major by rolling the soft tissue of the axilla over the ribs while supporting the anterior axillary fold. Lateral axillary nodes receive lymph from most of the upper limb. To palpate the lateral, or humeral group of the right side, insert your fingers of the left hand into the axilla, while slightly lifting the patient's right arm and supporting it with your right hand. You may even ask the patient to place his right hand on your shoulder in order to relax the axilla. Palpate the inner aspect of the arm in the axilla to feel for the humeral, or lateral group. The posterior axillary nodes receive lymph from the skin and muscles of the posterior and inferior body wall. They are palpated against the posterior axillary fold. To palpate the posterior groups, support the arm to relax the axillary muscles. Now face your palm away from you, feel inside the lateral edge of latissimus dorsi. The inguinal group of nodes are examined by exposing the inguinal region completely. The patient lays in the supine position, with the thigh extended and legs slightly abducted and externally rotated. Inspect for any obvious swellings or irregularities. Then, palpate inferior to the inguinal ligament, which runs between the anterior superior iliac spine and pubic tubercle, to assess the horizontal group of superficial inguinal lymph nodes. Position your fingers approximately 3 cm lateral to the pubic tubercle, and then palpate vertically downwards over the saphenous opening and the proximal portion of the great saphenous vein to assess the vertical group of superficial inguinal lymph nodes. These are enlarged in filariasis, STDs, and pelvic malignancy. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.